Welcome to our training on diabetes and diabetes management. So we're going to start off by talking about what's the difference in type 1 diabetes and type 2 diabetes. So type 1 diabetes results from an autoimmune reaction and usually happens in adolescents and young adults. Type 2 diabetes develops over the course of many years, and risk factors include excessive weight and lack of exercise. Risk factors for type 1 diabetes is unclear, but a family history may play a role. People with type 1 diabetes don't produce insulin. You can think of this as not having a key, whereas type 2 diabetes, these people don't respond to insulin as well as they should, and later in the disease often don't make enough insulin. So you can think of this as having a broken key. Both types of diabetes can lead to chronically high blood sugar levels. Symptoms of diabetes, if not managed, type 1 and type 2 diabetes can lead to symptoms such as urinating frequently, feeling very thirsty and drinking a lot, feeling very hungry, very fatigued and tired, having blurry vision, having cuts and sores that don't heal properly. So now let's talk about hypoglycemia. This is low blood sugar. Signs and symptoms of low blood sugar can include looking pale, shakiness, sweating, headache, hunger or nausea, an irregular or fast heartbeat, fatigue or feeling tired, irritability or anxiety, difficulty concentrating, dizziness or lightheadedness, and even tingling and numbness in the lips, tongue, or cheek. As hypoglycemia worsens, signs and symptoms can include confusion, unusual behavior or both, such as the inability to complete routine tasks, loss of coordination, slurred speech, blurry vision or tunnel vision, and severe hypoglycemia or low blood sugar can cause unresponsiveness, loss of consciousness, or even seizures. So now let's switch gears and let's talk a little bit about hyperglycemia, which is high blood sugar or elevated blood sugar. So hyperglycemia usually doesn't cause symptoms until blood sugar levels are pretty high, typically above 200. Symptoms of hyperglycemia develop slowly over several days and weeks. The longer blood sugar levels stay high, the more serious symptoms may become. Sometimes people who've had type 2 diabetes for a long time may not show any symptoms, even though their readings are high. Early signs and symptoms of hyperglycemia could include frequent urination, increased thirst, feeling weak or unusually tired. Later signs and symptoms of hyperglycemia can include something called ketoacidosis. This is very high blood sugars. So symptoms can include a fruity smelling breath, dry mouth, abdominal pain, nausea and vomiting, shortness of breath, confusion, or loss of consciousness. Typical diets with someone who has been diagnosed with diabetes, foods to eat and foods you should avoid. So typically a diabetic diet is going to be lower in carbs and processed sugary foods. So foods like cakes, pies, donuts, cookies, and including more whole foods like fresh fruits and vegetables, beans, sometimes whole grains. Many times a doctor will put someone who is a diabetic on a particular calorie count or carb count per day. So you want to make sure you know this and where to find this information in SetWorks. If the consumer does have a specific blood sugar protocol and a specific diet, this will typically be found on the consumer's first page in SetWorks under the Health tab. And you'll be shown how to access SetWorks in a later video. An average normal range for blood sugar is typically between 70 and 120. If the doctor has ordered daily or weekly blood sugar checks, here are the steps to do this. So you want to gather up all of your supplies. So if they have a glucometer, blood sugar machine, you're going to gather that up and have everything ready. You want to make sure the individual's hands are clean, their fingers are clean. So you're going to open up the glucometer. You're going to get a little lancet out and twist off the top, and you're going to insert that into the end of the little pin that's included with the glucometer, okay? Next, you want to get out a test strip out of the little bottle. You're going to insert that into the end of the glucometer machine. Okay, typically this shows a little drop of blood on the glucometer machine immediately. Then you're ready to stick the finger, okay? So pick a finger out. Typically you're going to do this around, not on the padding of the fingers, but on the outside edges, and you want to alternate this each time, okay? You don't want to pick the same finger each time. So after you stick the finger, you're going to apply the drop of blood to the end of the strip that's in the glucometer. You're going to record the reading immediately afterwards and follow the consumer's protocol if it's too high or too low. You're going to dispose of the lancet that's inserted into the end of the pin. And these lancets should be kept in a safe place. Never throw the lancets in the trash can where someone could possibly be stuck. So in a coffee can or a jug with a lid, so something with a lid, or a sharps disposal container. But never throw the lancet in the trash. So you're going to follow the protocol, but typically if their blood sugar is low, you're going to get some sort of carb along with a protein. So for example, a small glass of orange juice with peanut butter and cracker, or a small glass of soda with cheese and cracker. So you're going to combine this carb and protein together because the carb's going to bring the blood sugar up, but the protein's going to keep it stabilized so they don't crash shortly afterwards. But make sure you follow the individual's protocol. If you need to report anything, if it's during normal business hours, you're going to notify your team leader or the PM. If after business hours, you're going to notify on call for further orders. If it's an emergency situation and the individual's unconscious or it's very, very high, you're going to immediately call 911. Thank you.